Hello and welcome to this special interview on panic disorder in children, sponsored by the Anxiety Disorders Association of British Columbia. I'm Dr. Michael Catchpole and my guest is Dr. John Walker. Dr. Walker is a clinical psychologist and director of the Anxiety Disorder Program at St. Boniface Hospital. Dr. Walker, thanks for being here.
Thanks for having me.
Dr. Walker, let's talk a little bit about some of the signs and symptoms of panic disorder in children. Many adults looking at this video might have had a panic attack themselves. How is panic disorder expressed in kids?
Common problems that children have are stomach aches, feeling of nausea, dizziness, tight chest, chest pain, and children may mainly focus on one symptom. They may mainly focus on the nausea, for example.
Okay. Now, again, in adults, it's sort of more specific and often that, shotgun in the face kind of feeling. Is it that dramatic for kids as well?
It varies quite a bit between children. Some children may be focused mainly on two symptoms. Other children may have that feeling like you're just about to be in a car accident. You have an adrenaline rush.
Okay. Now, what can we do? What's probably the most important strategy that one should take as a parent or caregiver?
I think the most important strategy for parents is listening and accepting your child's feelings and experiences. So asking your child how they feel in their body when they're feeling upset and asking them what their worries might be. And you might have to ask the child whether they're worried about something very bad happening.
Well, that's interesting because I think a lot of parents sort of try to block a child's feelings. They think the right thing to do is say, oh, well, dear, this will get better. But you're saying the opposite. You're saying really validate what they're feeling?
Yeah, it's very important to listen and accept your child because part of what will help them is for them to accept how they feel and go on with their activities anyway.
All right. Other things that are important in dealing with panic disorder in children?
One of the key things after the validation is keeping up with normal activities and keeping up normal routines, especially things like going to school, going to sports activities, and really living your life in spite of some anxiety.
So in other words, avoiding anxiety reinforces it?
Absolutely. The most serious impact of anxiety problems if someone starts avoiding their normal routine. That has a negative effect on their lifestyle.
Or if a parent encourages them to do that, I guess the parent's trying to protect the child, but in fact they're unintentionally reinforcing the anxiety?
So accepting the anxiety but giving the child the message is important to keep up with life's routines anyway, and if they keep up with routines, actually they'll feel much better at the end.
Very interesting. And would that include, rewards or sort of positive feedback for them mastering things that are hard for them?
So when a child faces a difficult situation where they're afraid they might have this bad feeling like dizziness or stomach problems, if you celebrate afterwards by going out for a little snack together, use a lot of praise, that's very helpful.
Very interesting. What about breathing techniques or ways that some adults use to calm themselves?
Very often if a child is very worked up, you can even watch their breathing a little bit to see if they're breathing fast. And if you feel they're feeling really worked up and they're telling you that, just teaching them to breathe slowly and regularly, breathe through their nose, can really help themselves to calm themselves when they're really feeling worked up.
What about self-talk? Are there things a child can be saying to themselves when they're beginning to become panicky?
When a child is feeling anxious or not wanting to go to a certain place, like not wanting to go to school, just teaching them that they can talk themselves through it by saying things like, my stomach feels really upset, but I know I'll be okay. If I have to take a break, I can go to the office for a few minutes and then go back into class. Those kinds of strategies really help the children to cope.
So in other words, don't avoid anxiety. Anxiety is unpleasant, but don't avoid it.
That's a key point, really, that all of us will experience anxiety in our life and all of us will experience some stressful circumstances, but if we keep up with our normal routines, if we keep up with our social life, we'll get through it very well.
Excellent. Dr. Walker, thank you so much. Very, very interesting, and we appreciate your help. Hope you enjoyed that interview with Dr. John Walker, clinical psychologist from St. Boniface Hospital.